When do I need to get a transvaginal ultrasound? A transvaginal ultrasound is a very helpful screening tool, and while it's often used as a diagnostic tool, diagnostic meaning it's often used to tell us when we have something wrong, when we have a fibroid, when we have an ovarian cyst. It can also be used as a screening tool to make sure that the lining of the endometrium is normal and to look for any abnormalities or just any hints that something might be going on in the ovaries themselves. It's also a great tool to use if you're not sure if you might be having fibroids or any type of polyps within the endometrial lining. So I love transvaginal ultrasound to use often and frequently. It's not always covered by insurance, but there are lots of places that are offering transvaginal ultrasounds for much lower costs now because women are requesting them more, even when it's not necessarily indicated by an insurance company. It's a good idea to get a transvaginal ultrasound for everyone at the age of 45. That's the age that I usually like to recommend making sure you have at least had one transvaginal ultrasound, so you know that if there's something going on in the uterus that you don't have any symptoms of. The other time when it's a really good idea to get a transvaginal ultrasound is if you have any pain or pelvic pain, if you're having any irregularities or anything that's really out of the ordinary for you when it comes to your menstrual cycle has suddenly changed really significantly, not just the little changes that we have from month to month. And the other time is when it's really imperative to get a transvaginal ultrasound is when you are post-menopausal or you have gone one full year without having a menstrual period and you start to have bleeding. So we see this a lot. We see a lot where women will start on HRT, they'll begin a hormone replacement regimen that actually includes estrogen, and they might have more bleeding, more spotting, and that's something that's really common. This is a great time to talk with your healthcare professional and see, based on when you had your last transvaginal ultrasound, if you've ever had a transvaginal ultrasound, is this a good time to consider getting one done?